Hello guys, welcome back to our Swasth Bharat podcast where we have Honorable Ma'am Dr. VL Bhargava, who is a gynecologist, today with us in our episode. So welcome ma'am. Please ma'am say something about yourself.
Thank you very much for asking me to narrate a few things from my life. You see, I do not know at what age, but I grew up with the idea of becoming a gynecologist. I didn't work especially hard for anything. It just came to me. And about my school education, about my college education, without my working hard, I just sailed through the everything. And I graduated in 1956 from Lady Hardinge Medical College. I did the post graduation from the same institution, got my initial working experience from the same institution. I graduated in 1956. I worked as a house surgeon, then as a registrar, then as a demonstrator in the clinical department, and did my post graduation at the same time while I was working. I had an opportunity to go under Colombo Plan Fellowship to Australia for a year, and there I gained very good experience in endocrinology and oncology, gynecology. I came back from there and joined as lecturer at Lady Hardinge Medical College again. Before I did that, I worked 1.5 years at Central Hospital, Asansol, Kalla, as a gynecologist in charge of the unit. 1.5 years that I worked there was a boon in my life. Probably, I think it was a godsend opportunity for me.
Okay, so why that? Why are you saying this, like boon in your career?
Because you see, at that time, in the city of Delhi, nobody was really doing gynecology surgery.
Oh, really?
Not very much. They did only plain ones, which came, but advanced cancer surgery for cancer cervix, for cancer ovary was not being done.
Okay.
After that, as lecturer in Lady Hardinge, I joined 𝐒𝐻𝐿 as an assistant professor.
Okay.
And there I worked for 20 years in the faculty positions till I retired in 1993.
What was your experience in 𝐒𝐻𝐿 over the 20 years?
See, in 𝐒𝐻𝐿, I'll tell you, I began in 1973. I was given the cancer clinic to do.
Okay.
And there, at that time in 𝐒𝐻𝐿, the radiotherapy was not complete. Only external radiotherapy was being done, which was incomplete therapy for the treatment for cancer cervix.
Okay.
So I started operating even in those cases which were not very favorable for surgery, and because there was no complete radiotherapy in that institution. That experience for me was really very good. And another thing which I just started when I came, there was an old colposcope. So I took it out, started doing colposcopy along with cytology, and gradually we developed colposcopy.
So how did All India Medical Sciences treated you as a professor?
Very well. I had absolutely independent working. Nobody interfered with me.
Okay.
I was allowed to do whatever I wanted to do.
Interesting, or your memorable case which you remember?
Very memorable case which I'll never forget in my life. It was a 60-year-old lady.
Okay.
About 3-4 years back, previous to when she came to me, she was seen at Safdarjung Hospital. She was taken up for investigations for bleeding in the after menopause, and she had cardiac arrest, so they closed her up and they did nothing. After that, she went to Calcutta, and their external radiation was 5 or 6 sittings were done, thinking that she was probably uterine cancer, and they sort of stopped after 6. So I admitted her in one of my beds, and I started her on the treatment for failure anemia, gave her XL transfusion. I can't give her anesthesia and risk her another cardiac arrest.
Seriously.
So I just did a 1-finger examination and got a little discharge, bloodstream discharge on my finger, sprayed on my slide and sent it for examination. They said there's some endometrial cells. They did not tell me anything else. And endometrial cells at that age, thinking if that is there, that means she is a cancer endometrium. I started treating her with progesterone injection, which it just occurred to me that progesterone can have this effect. So I gave her once in a week injection, thinking that in pregnancy you give it for 9 months and the things remain all right. So I gave her for 9 months, and she stopped bleeding after 3 injections. Her condition improved, and then after I stopped the injection, she lived for 10 years before she died of thrombosis. And that particular experience that a cancer could be reverted back by progesterone led me to use this progesterone injection, in nulliparous young women who are wanting to have more children.
Okay.
So I called her in-laws, I called her parents, and I asked them if it is okay. I would like to treat her with hormones. There is a chance she may be cured. In any way, treatment surgery has to be done, so we'll do later, but we'll give her a chance. She might.
Yeah.
So she improved. After that patient, I treated only for 6 months, reduced 3 months.
Okay.
And then she was reverted back. So thinking like that, when you just think and do it independently,
Yeah.
you can really do a lot.
True.
So
Seriously,
that is
great words. And ma'am, I would also like to ask that people they face very anxiety and these kind of disorders. They are very scared of these gynecological procedures.
Depends upon how you present the procedure to them.
Okay. Yeah.
And how you sort of talk to them.
Okay.
You can always be either very in a harsh way you can tell, or you can tell everything in a mild way.
Okay.
Supposing there's a patient whom 50% chance of survival.
Okay.
You see, if I say there is a 50% chances that I will not be able to treat you.
Mm-hmm.
You see, that's a negative way of talking.
Exactly.
But I always tell everybody, you see, percentage is only for the calculations and deciding what you want to do.
Yeah.
But supposing even if there's a 2% chance of survival, you might be that 2% chance.
Exactly.
And that gives them so much of confidence that they are willing to accept the things. Except very, 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 very rare people.
Some of the old technologies and new technologies. What is the mixture of those technologies which you using it, making it more and more reliable for the patients?
Yes, that is what I'm saying.
Yeah.
Now, we have a history. I'll take it for, say, obstetrics.
Okay.
We had done cardiotopographic study, and this is that. It shows a little compromise in the patient.
Yeah.
Now you have to decide, you have to take the other things in consideration before you decide what line of treatment you do for the patient.
True.
Whether you let her carry on for a while, do successive investigation, or whether you should deliver immediately. What is happening, that is be your, not only your technology thing, but your clinical assessment also. What is the size of the baby? What is the like? What is the movement like? Everything else you have to decide before you do. In obstetrics, there's a lot of advancement, as I told you.
Yeah.
There all the investigation nowadays. We've got methods of finding out the congenital abnormalities. We've got methods to find out the various infections which can affect the babies at an early stage. So we've got a lot of things, but you've got to decide how much to do in a patient.
That's required. With this, I want to ask you, do you think this new advancements and new technology has, cons, basically?
No, I would say the selection of the patient for a particular test.
Okay.
I would not say they are harmful.
Okay.
They are very useful tests.
Yeah.
But you must select which patient requires that. Okay. Not that you've got one test and therefore you must do in every patient.
Yeah. Girls must have been very curious to know about like PCOD, PCOS, as you said.
Just reduce your weight.
Yeah.
And reduce your change your diet.
So they just need to change their lifestyle.
Diet, definitely.
That's it.
Definitely, that goes a long way. Okay. Second thing is the history. If they've got the history of diabetes in the family, they are more prone for PCO. So you can study the insulin reserve in them.
Okay.
Because if they've got insulin resistance in them, you can treat them with a drug which is responsible for treatment for insulin resistance.
So I have one more question in my mind with this. Like again, on PCOD, PCOS, many of the girls, they are like really scared when they go to a doctor. Like they go for a radiological checkup, ultrasound or something like that. So what do you want to say about that?
Every month, an egg develops. It becomes large in size, and then it ruptures. Okay. Supposing it does not rupture, then it forms a retention cyst into the ovary. Okay. Or supposing if there is a sort of each cycle, there might be more than one egg which is developing. So there may be one may be ruptured, the other may be seen in multiple things. Okay. So just by one clinical picture of a cyst does not mean cysts are of various kinds. These are physiological cysts which are developing, disappearing. Exactly. But there are cysts which will grow further, which need surgery. Exactly. So cyst and cyst differ.
Okay.
So let the girls not be scared of the cyst word,
Yeah.
because that may be normal.
Yeah.
All they need to do is to take their ultrasound to some doctor and show. They'll explain to you whether the cyst is significant or not significant.
Exactly. So I wanted to ask, what are the biggest misconceptions and myths about the gynecological health people have? So what do you want
You
to
see,
say
the
about
biggest misconception which is there is people thinking that menopause is a very abnormal period at which they will develop all sorts of abnormal things.
it? Okay.
That is the biggest problem which I have when the patients come and ask me.
Yeah.
And actually, menopause is only a physiological process. And the main symptoms which patient complain of, I've got mood swings, doctor, I get very irritated, I get hot flushes, I cannot do this, I cannot manage, I just feel irritable, I feel very angry. You have to explain to them this is a natural phenomenon of the changing proportion of hormones.
Okay.
And therefore you shouldn't worry.
Okay.
Second thing which comes is the mood swings.
Mm.
Everybody thinks, I'll become very irritable, they always fight with me and this is. But these mood swings happen in those people mostly who are emotionally weak.
Yeah.
So that is something which happens.
So, ma'am, even I've heard that after menopause, most of the women, they think that after the menopause they are tend to generate too many of the disorders, chronic diseases.
No, you see,
is it
there are many diseases which are age related.
Okay.
Which occur in menopausal age group, but they are not due to menopause.
Okay.
But there are certain changes definitely which happen because of the lack of hormones.
Okay.
Because these lack of hormones sometimes reduction. There's a absorption of some nutrients from the gut, which also happens because of the aging.
Got it.
You have got the weakness of the bones which occurs not only because of the lack of those things which are happening, but it is also because of the aging of the tissues which are in your muscles are also becoming weak.
Yeah.
Everything is aging, and therefore age-related things are added onto the thoughts of menopause. The people who think that menopausal changes are.
So, ma'am, what kind of advice do you want to give to our young females and elderly ladies also to get them a good gynecological health, basically? What kind of advice?
You see, number one, I will advise them that all the phases in a woman's life are physiological phases which occur in every woman. Say a very young girl, it is worth knowing about the various things. She must be knowledgeable, and therefore I think education to the young girls is important.
Very important.
Second thing is when they get married, even the education about having children, advantages, disadvantages, and what are the problems they have, they must have ample knowledge. And it is very important. Nobody should be shy, feel shy about. I particularly feel that it is worth taking a premarital counseling from a doctor.
Okay.
It is always good to have some sessions of a good health adolescence. Then there should be during pregnancy, of course, everybody knows that pregnancy care is very important.
Okay.
It reduces not only maternal but fetal morbidity, mortality also. And then in old age, it is always a good idea to have a clinical checkup every year.
Okay.
That is what I would feel. Weight is a very important negative factor as far as female health life is concerned. And therefore, I personally feel diet plus food, proper food, and then exercise and proper mental attitude towards the things is a very important.
So with that, thank you so much, ma'am, for such a meaningful discussion and with so much important topics which we have covered.
And thank you very much for asking me.
Thank you, ma'am.